And I'll just do a very brief intro before I hand over to Fabrice from Mindia. So I can see quite a few familiar names checking in. So hopefully most of you have met myself. So I'm Annemarie. I'm the owner and principal audiologist at Hearlix. And I have a very big passion around tinnitus and managing tinnitus and providing support for people. Um, if I know a few names popping up, and we're often having quite big discussions about the latest research or the latest thing to help people with tinnitus. And so I am always looking at what could I offer patients or what could be there to help. And Mind Ear is certainly one of the best apps globally available around the world. And when the opportunity came up to host a masterclass, I definitely jumped on it. I think it's going to be a wonderful opportunity for everyone to have a listen and to see what it is available, and to see hopefully that it's something that might offer you some help and some guidance towards your tinnitus. So enough from me. I'm going to hand it over to Fabrice from Mindia, who is joining us all the way from France. So thank you so much, Fabrice. I'll hand it over to you.
Thanks a lot, Anne-Marie, for the introduction. And yes, I'm going to share my screen now. I'm going to see. It's going to take 1 second. Great. So you should see my screen normally. So my name is Fabrice Bardy. I'm an audiologist and a neuroscientist, and the co-founder of MindEar. And at MindEar, what we try to do is to develop a comprehensive solution to help patients who experience tinnitus. I've been working in the last 6 years in the development of the platform. Everything started in Sydney. I did my PhD at the Australian Hearing Hub at Macquarie University, where I met my co-founder, Mathieu Recunia. We're still in Sydney. I've been moving a little bit different place in the world in between because of professional and personal reason. And but it's always my pleasure to sort of like talk to people like you about what we developed and how you can benefit from it. Um, you can hear like a clock right now, which is like the clock of my grandparents in France, where I'm currently located. And normally it should be it should be the last time. It's once a year, so we should be the last time before the end of the station. But today, I would like to mention to you and talk about the goal and the agenda that we're going to have. So we're going to talk about tinnitus profile, and we're going to talk about the challenge of tinnitus, in the sense that in many cases there's multiple symptoms that can be associated to tinnitus, and generally the solution that we're going to or the way to be able to handle it the best way possible is to get a combination of treatment option or techniques. And we're going to see that it's a combination of what you already been speaking with Anne-Marie, and she has been working with you already in order to regain control. And you're going to see that it's possible to regain control, but you will probably need a combination of techniques in order to get the best result. We're also going to talk about the stages to relief. It's a journey. It doesn't it doesn't occur immediately, but you're going to see that with time and with the right support, you're going to be able to get to the point where tinnitus is not bothersome. And it's really important to remind yourself any point in time, even though it might have been challenging, that it's possible to get to this point where your mind is able to filter out the sound. We will talk about habituation, what it is and how it works. And I will introduce to you the MindEar program that we developed, which is as a combination of tools that might be complementary to what you already been doing. And the goal here for the session, will be at the end of the session if you have a better understanding of the journey to recovery with the different stages, and if I can help you to understand which kind of tool are accessible and that you can basically get access to in order to get tinnitus relief. Um, let me just. I'm trying to find the. Okay, all good. But before starting, actually, as I was trying to look at the poll, I would like to ask you one question, and that's going to be, I'm going to try to make this session as interactive as possible, and it's going to help you to understand where you are at in your journey. My first question is like, I would like to understand on a scale from 0 to 10, how much bothersome tinnitus has been in the last 7 days. So you should be able to see like a poll on your screen where you can answer. 1 is not bothersome at all. 10 is extremely bothersome. So and that will be lovely to hear where you have been in your journey. It's going to give us like an indication about where you are at. And we will also, I will be able to tailor it a little bit my talk depending to where you are at in this scale. Excellent. So I can see like 80% of the participant already answer. I'm going to give you a few more seconds, like let's say 5 seconds, and I'm going to share the result. So here we go, and the poll, and I'm going to share the result with you. And you're going to see that in this room, there's really a variety of like level of how tinnitus is bothering us. From 1, which is not bothersome at all, to 8, where we can see that it's quite bothersome. You're going to see that what we're going to talk during this masterclass is going to be techniques that are going to be able to make that we can decrease the level of how tinnitus is impacting you to a level which can be, if in case you are like in case you are it's like an 8 or a 7, we want to be able to get it down to 1 or 2 or 3. So and meaning that we want to get to a point, and what we're going to talk a technique that allows you to basically make that we decrease the level of the weight it's impacting you in your life. So thanks a lot for sharing this information. It's helpful, but we can see that already there's a variety. It means that we are all, tinnitus can impact us all very differently. And that's a very important thing to, it's a very important thing to remember in the sense that we are individual, and the way that tinnitus is impacting us is very individual. And you can see on this screen, so I'm going to, so you get tinnitus in the middle, but there's a lot of symptoms associated with tinnitus. In red, you're going to see here we have hearing loss, and it's probably something that you've already been talking to Annemarie. There's around 70% of tinnitus patients who are also experiencing hearing loss. And we know that hearing rehabilitation using hearing aids or other kind of stimulation of the cochlea can be a very good way to decrease the impact of tinnitus. And this is something that I would like you to really continue talking with Annemarie, which is there to help you to basically do a hearing assessment, but also to fit your hearing aid to your specific need. And we're going to see that by providing hearing rehabilitation, we're going to decrease the perception of the tinnitus, meaning that by providing hearing in the frequency where there's a hearing loss, we can definitely help to decrease the perception of it. Now we can see that there's other symptoms that can be associated. And it's really important to understand that we want to be able to address the symptom in case they are present. So you can see anxiety, depression, stress. And for these symptoms, it's often a bi-directional relationship that we have. And what does it mean is like sometimes anxiety can increase the perception of the tinnitus, but it can be the opposite way. It can be tinnitus, which is increasing also anxiety, creates stress, who has an impact on our well-being. And if it's the case, if we see that there's a stress factor, and we can see that there's an increase of that, the perception of the tinnitus in case of stress situation, then we can have techniques or strategies that can help us to better manage stress. Another thing which is very common is something called, which is sleep difficulties. And generally, we have 50% of our of the people who are contacting us who express that sleep is one of their main difficulty. And in this case, we need to be able to help you to sort of like regain a good sleep, and that's essential. A bad sleep is often going to lead uh, to some fatigue, and the fatigue is going to make that it's more difficult to get focus or get attention, which can impact your work, which can impact how you feel, and overall make you feel like potentially less in control. The last thing which is important to remember is like it could be a somatic component in the tinnitus. And what does it mean? It's like, and the somatic component is also a body component where tension in the jaw or tension in the neck can also have an impact on the tinnitus. So generally, when I'm talking about tinnitus, I really like to understand what is a root cause. And we have the first, which is a cochlea. Then we could have a root cause which can come from the body for the somatic component. And for all this element, I will call that central tinnitus. And like before we continue, I would like to ask you actually another question in order to try to understand you a little bit more. And it would be lovely if you could tell me what are the factors or what are the symptoms that where you feel the most impacted. So you should again see a question on your screen, which allows you to answer. And you can answer, you can have multiple choice. So don't feel limited to select only one thing, but you can select multiple things. And thanks again for answering this question, because it's going to be both very interesting for you to see the variety of symptoms, but you're also going to be able to understand afterwards that depending to these symptoms, we're going to be able to have different treatment options. Great. So that's a great interaction. And I'm going to give you another 5 seconds, and I'm going to share the result with you. So great. I'm going to share the result. And so what's interesting here is like we have really a variety of symptoms that you have been selecting, that you selected. The first is the cochlea or the hearing loss, and then there's 55% of you who basically selected that. The second largest symptom afterward is going to be increased stress and anxiety and trouble concentrating. And that's something that we often see, meaning that the impact of stress and anxiety on our life and on tinnitus can be very significant. And we're going to see that the solution that we have to help with the cochlea or the hearing loss is going to be very different than the solution that we can basically provide in order to decrease or provide a better control of stress and anxiety. Then we have sleeping difficulty with 35% of you who experience issues sleeping. somatic tinnitus, which is like this link between neck and jaw tension and the tinnitus. And then with 25% are going to experience negative thoughts or worried that it will get worse, different worries, and is going to have a negative impact on the work and on the productivity. Then there's 20% of you experience other factors, and meaning that you can see that it's very a complex, it's a complex symptom, and it means that we need to get access to different techniques in order to help you on this different domain. So thanks a lot again for sharing. I think it's very interesting to get your input, and it helps you. It helped me also um, to adapt my presentation for today. Um, the next thing that I would like to talk to is about the journey to tinnitus relief. That's not something which is linear generally, and it takes a little bit of time. The way we are, like the way I see it is like we can see different stages, and I'm going to try to help you to understand this, understand what's happening in these different stages. Generally, stage one is what we call awareness, and it's going to be the stage when you initially start perceiving the sound. It can be extremely distressful. It's probably the time when it's the most distressful because we don't know what is happening. We don't exactly understand the reason why the sound started, but we can also be very worried about the consequences and how we're going to be able to deal with it. The second stage is what we call allowance. And allowance is probably the most challenging stage to get through. You're going to see that the more you fight the condition, the more you're going to fight, the more you're going to want to get rid of the sound, and the more it's going to get back to you. And if I now ask you to stop thinking about the pink elephant, don't think about the pink elephant, don't think about the pink elephant, then the only thing that is going to get back into your mind is going to be this pink elephant, which is increasing in size and increasing. We're going to see that getting to a point where we're able to see the sound that we hear as a benign stimulus is going to be a really important step for you to accept its presence, but also allow your brain to filter it. And we're going to talk a little bit more about this. I always like to see, sometimes it feels like tinnitus is the worst thing that's happened to us. But I would always like to see that there's an opportunity to learn different things and to transform that experience into something positive. And you're going to see that in this journey, you're going to learn techniques that you can use in your life, not only for your tinnitus, but you can unlock some mind power which can be used in other direction. And that, I think, is like very important to remind yourself there is definitely something positive that can come out of like this difficult situation. Stage three, acclimation, and we're going to talk a little bit more also in the future slide. And then stage four, which is called achievement, which is a stage where you feel in control. And what I mean feeling in control, the sound that you hear must still be present, but it's not creating a reaction in you, meaning that you hear it, but it's the frustration, the anger that it's reaction that it creates is highly diminished, and you feel in control in the sense that you feel that you are able to focus on the things in your life which are really important. So and I'm going to get back and I potentially already talk a little bit of the different stage, but in this awareness stage, in the stage one, often we try to look for information. We have all often this tendency to look to Dr. Google, which can be good, but which can also be really bad in case we look into forums where there's often very negative story, which can be that we can read, and it can basically often increase the distress. So, and it's where we created Mind Years, meaning a person like Annemarie or myself, it's generally a better idea to talk to a professional, which is going to be able to guide you in and provide you the information that is curated. Um, Allowance is this stage, as I say, like it's really important to recognize that the sound that we hear is harmless. And the thing is that is really important. So it's generally the start, that it's a benign sound and that is not going to hurt you. Once we recognize that, it's all from the start to this recovery process. We're going to accept that the tinnitus is present, but we also see that the tinnitus is not defining us, that there is things, it's not going to stop us to do anything that we want in life. Acclimation, so it's a phase where slowly, step by step, week after week, you're going to feel that the tinnitus is getting less bothersome and less noticeable. It takes a little bit of time and we need to be patient, but this is going to happen and you will get to the point where you feel in control and where you feel that it's not longer causing any distress and doesn't interfere with your daily activities. So now that I explained this fourth stage, actually, I would love to, again, I will try to ask you a question. And I need to find. Yeah, here we go. So you should have a question on your screen, and I would love to hear where you feel you are in this journey, because it's also it's going to impact what sort of like technique and what sort of like treatments that we're going to recommend you. Um, and again, sometimes it feel that so there is like different stage one, two, three, four. It's like in case you feel that you are between two stage, it's okay. So feel um, uh, um, just select the one where you feel that you are the most often in, and it's also cases where we fluctuate, meaning that there's day where we feel that in we are in the awareness state or like in the allowance stage, where days where we are more in the acclimation phase. But I'm going to end the poll and share the result with you. And we can see that there's definitely a variety of in variety like you had all in there's a distribution in this different in how you are perceiving yourself and where you feel you are in this journey. For people who are in the awareness stage, it's generally a very challenging and stage, but the first very positive thing that you are doing is participating to this session. Um, it's challenging, but you're going to see that by getting access to the right support and the right tool, you will be able to get to the stage four. And meaning that being in this session today is probably the best way to make that we get to stage four as quickly as possible. So, well done for being and for participating, for founding Annemarie, and for basically being proactive in this journey. And you're going to see that you're going to be rewarded. For people who are in this allowance stage, it's also definitely a very challenging stage to basically not fight the tinnitus. We have this tendency of like, and that we all have different personality, but some of us have what we call fixer. We like to solve a problem. We like to fix problem, and sometimes we want to find the thing which is going to be the fix for the tinnitus. In this stage, it's going to be really important to recognize that potentially a lot of the power is in you and in your mind, and the way you're going to react to the situation is going to be the best way to allow to decrease the way it's impacting you. Again, we are here to support you, and we are here to guide you to find the techniques that will help you to get through this phase. I love to see now that there's already 45% of you who are in the acclimation phase, meaning that you have been working, you got hearing rehabilitation, you got some counseling with Annemarie, and you already been able to get through this phase where your tinnitus is slowly decreasing in perception and in how bothersome it is for you. And so, well done for all the work accomplished, and you are definitely on the way to stage 4. And finally, for the person who is in achievement phase, congratulations. It just means that it's possible, and it's that with the right tool, you're going to get there. So well done for getting there. And then you are an inspiration for all of us to be able to get to the next phase. Um, the next topic that I want to talk about is habituation. And so, like in the acclimation phase, I was mentioning that the perception of the tinnitus is decreasing, or the both how the distress, the way tinnitus is impacting you is going to be decreasing. But what I want to show in this diagram is to help you to understand how things works. In gold, you can see here, this is a tinnitus level, which is fluctuating. There's good days, there's bad days. There's day where you're going to perceive that the tinnitus is nearly not present. There's day where you're going to feel that it's louder. And you're going to see that there's variation. It's a little bit like in life, you're going to get good and bad days. In green now, you're going to see that it's like the level of distress that is created by the tinnitus. And you're going to see that with time, this is going to slowly decrease, and you have the stage at the top. But with time, even though the tinnitus might still be present, you're going to see that your brain is going to be able to filter out the sound. And that's really what we're going to try to achieve, or that we're going to help you to achieve. Now, in terms of treatment option, you saw that depending to the symptom that you have, we're going to try different techniques. So for hearing, in case of hearing problems, Annemarie is on your side, and she's a specialist that you need to talk to in order to basically address the hearing loss. And in 70% of case, there's going to be a significant improvement on the perception of the tinnitus in case you get the right hearing rehabilitation. So that's really important to get the right person on your side. Annemarie is here for you in order to help you to achieve that. So that's already a very important aspect. Now, and we saw that 50% of you experience stress and anxiety. And in this case, cognitive behavioral therapy, mindfulness and relaxation are going to be really important techniques that are going to help you to regain control on that. And we're going to talk a little bit about how we can help you, but it's really the role of Mindy is to help you to get access to this technique, which has shown to be extremely efficient to decrease stress and anxiety. Then we have a sleep program, and in this we add like 33% of you who had like sleeping difficulty. Here we're going to try to help you to better fall asleep, but also how do we manage this 4 o'clock time where we wake up and we have difficulty to fall back to sleep. So there's technique, and you're going to see that often we can also use some of the cognitive behavioral technique in order to improve our sleep. Improving our sleep is going to be really important to feel better. And to feel better during the day, meaning that you're going to get more energy, and you're going to see that generally is going to automatically get you into a better place. Then we have education about how to decrease jaw and neck tension, which we call temporomandibular disorders. So we give you access to exercise to decrease the tension in your jaw. And then we give you access to sound therapy, which is so you got access to the hearing rehabilitation. The sound therapy can be accessed through the hearing device. And Anne-Marie, and for the sound therapy, we're going to work together in order to give you the the a personalized program for getting access to the sound that you did not hear anymore because of the hearing loss, but potentially also giving you access to a sound masker, meaning that it's an additional sound that we can add inside the hearing aid. But we will talk about that a little bit later. So how did we develop the MindEar program is like we developed a program where we try to help you with these different dimensions. So decreasing the fear is a first step. We're going to promote relaxation and reduce the stress. We're going to improve the sleep. We're going to help to understand grief. And as I think it's a very important aspect. When we experience tinnitus, we often we lost something which was really important for us, which is the silence. And we feel that there's an emotion, there's some emotion in everything that we lose in life. Can be very difficult emotionally, and understanding the stages in grief is really important. Understanding that there's a phase where we are in denial, understanding that there's a phase where we feel depressed, understanding that there's a phase where we feel that we accept the current situation is really important, and it helps us to move inside this journey. So we talked about that. And I found it very helpful generally to acknowledge the grief and acknowledge what we're experiencing. Then we learn how to use sound therapy, and we also need to acknowledge that this is a process. So it requires resilience. It's challenging, but resilience is also a sign that you are learning. So when it's difficult, when it's challenging, it's just a sign your brain is adapting. Your brain is plastic. It takes some time to reorganize. But during this time, you're going to see that you're going to learn techniques that are going to help you in your life more broadly than just for the tinnitus. So the way we interact, we use some Zoom session, and we use some group coaching session where we are in small groups between 5 to 10 people, where we have the possibility to learn from each other and feel that we are not alone in this journey. I'm generally leading the session with the support of all the experts, but during the session, we're going to talk about all these different techniques that were mentioned in the previous slide. And my role is to equip you with the strategy that are going to help you to manage the different symptoms, so that at the end, you feel that you have option and you have things that you can do in order to improve. The way we developed the program was in collaboration with a lot of different experts, tinnitus experts worldwide. We conducted some research in collaboration with quite a few different universities in Auckland with Professor Susan Purdy, in the UK with Dr. James Jackson, and at University College London with Dr. Lucy Anscombe. My co-founder, Mathieu Recugna, is a biomedical engineer who is passionate to develop solutions who can make a difference to people's life. And we are also Professor Laura Jackman, who is a clinical audiologist and tinnitus researcher, part of the team, as well as Michael Piscos, who is an audiologist and tinnitus specialist. So we are all experts. We bring our expertise in different domains, and that was really important for us to get a team of experts to develop the program and to validate it. Now it's probably the last thing that I'm going to talk about. Like we have, so in order to get better, so the way we work is like, as I mentioned before, we have group coaching session, which are happening every second week. And I will encourage you to talk with Annemarie if you're interested to join the program. She will be able to enroll you. And the way we the way we work is like we have the group coaching session, but we also developed an app which is on in your side, in your pocket, any time of the day. And the reason we developed the app is to help you to get some support 24/7. So we might meet each other once every second week, but in case at 2 a.m. in the night you feel distressed or you feel stressed, then you have something that you can do in order to regain control. So inside the app, there's going to be a lot of education, a lot of things that you're going to be able to learn about the techniques that I mentioned earlier. You're going to get access to some sound therapy. So we have a library of sound which allows you to and the interface inside the app allows you to fine tune the soundscape, each soundscape to your liking and to your hearing loss. This is very unique, and it's going to really help you to identify and create a sound environment which can be helpful either at night or during the day when you're at the office. Um, it's giving you access to relaxation exercise. So the things that you're going to learn during the course, you can basically practicing. You can practice it using the app on your side to engage with, for example, some mindfulness or relaxation exercise. And lastly, we have a auditory screening. But in the case with Annemarie, in case you saw Annemarie already, you might already have been doing like a hearing test with her, which helps you to understand your hearing needs. And lastly, I would like to talk about, give you an idea of like what sort of like progress that we can expect within 12 weeks. This is the example of someone who enters a program. It was starting in November 2024, 27th of November for the first assessment, and then we looked at his result the 20th of February 2025, so 12 weeks later. I'm going to talk about, and I will explain a little bit what is TFI, what does it mean? The Tinnitus Functional Index is like a validated questionnaire that helps us to understand the severity of tinnitus. It's a scale that goes from 0 to 100, and you can see here that 0 to 17 is considered not to be a problem, and where in the opposite end, from 73 to 100, tinnitus is considered to be a very big problem. For this person, we started the treatment. His score was 72.4, and meaning that we were really in the range of this being a really big problem. And after 12 weeks, what we were able to achieve was to reduce the score to 25.2. And meaning that we were able to get into the range where tinnitus was a small problem. And I think this is a realistic thing to be able to expect. So when we enter the program, within 12 weeks, we can basically get to a point where tinnitus is significantly impacting our life and get to a point where, okay, the sound is still present, but it's not bothersome anymore. Now, this is a spider graph which I like to see, which help us to understand the progress. So in the dark green, we can see the score before starting the program, and then in the light green, we can see the score after the program. For this person, we can see that we were able to help mainly in all the subscale. Apart, like, so we can see that the emotional aspect, we were able to help a lot. The auditory aspect was also improving a lot. Quality of life was improving. Relaxation was improving. However, at the end of the program, we still saw that sleep was still a problem. And in this case, for this person, we continued the treatment in order to help him to basically to found new techniques in order to improve sleep. It's not So it means that at the end of the 12-week program, we're going to do an assessment and we're going to see what is your current situation. And in case there's one element where you feel still bothered, then we're going to target and help you to get access to technique for this specific element. So it gives you a little bit of an idea of how we are working. And I see that it's already 14 now. So I want to basically, and potentially, if we have a few minutes, I will show you this testimonial from someone who has been through the program. But now I'm going to stop sharing my screen. And Mary, before we like maybe at the end, I can share this testimonial. But I give you the microphone again, and that will be lovely if you can sort of like probably. Tell your patient how they can sort of like interact with you in order to engage in the program. If you have any question, you feel free also to contact Annemarie. She will basically transmit the question to me, and we will be able to answer them as best as we can. The goal here, if I can summarize, is really so we try to develop and create a tool, a suite of tools that can allow you to regain control. It's really important that even though tinnitus can be bothersome, it's possible to get to a point where we feel back in control and where it's not impacting your life. And if there is one message that I want you to keep from this presentation, that it's definitely possible to get to this achievement phase. Everyone in this room will get there. And so even though we saw this distribution of severity, I really want to remind you that this is a process. It's like a journey. It doesn't appear immediately, but it's possible to get better with the right support and with the right tool. So thanks a lot for your time. Now, Anne-Marie, I'll let you finish, or I'll let you give information about how people can contact you in case they're interested also. And then thank you again for your attention.
Yeah. Thank you, Fabrice. That was really, really informative. I think one of the take home I really liked hearing about was that taking that time to understand that, understanding grief, so that loss of silence. So I hope others got some key takeaway messages. For me, what is important as part of Hearlix is that you have seen that Mind Ear, it is a worldwide like panel of experts. People often come to me and, you know, absolutely, Dr. Google, it has its place and there's lots of things you can find out great information, but on most of the time, information on tinnitus can be very misleading. And so to find a very evidence-based option is really, really important. We want to see the science. We want to see the research behind it. And this is like, if you look at any of the research around tinnitus management and tinnitus relief, it is around mostly cognitive behavioral therapy. So to have a very easily accessible option for this, it's really exciting. And if people would like to reach out and understand a little bit more, at Hearlix, we do offer, and perhaps some of you have already had it, like a time and talk appointment. So you can come in, it's complimentary, it's exactly that, it's time, and we can talk about the next steps and what's really good for you. If you can't make it into the clinic, we can do a phone call. And of course, please send me an email. So I'll put my email in the chat. But please call the clinic, or you can email me at info@hearlix.com.au. So I'll just put it in here. Fabrice has also put my contact form in the chat there. So I'll just put the email in. But I just want to say a big thank you, Fabrice, and thank you everyone for attending tonight.